Hi, I'm Dr. Manisha Talim from Mumbai. I'm here on Sify.com.
Doctor, as an expert, please emphasize on the reasons that trigger type 1 and type 2 diabetes.
Type 1 diabetes is less common in our country. It is an autoimmune disease wherein the own cells of the body start attacking other cells. In diabetes, that is against the beta cells of the pancreas, and it completely destroys it so that the patient no longer has insulin. We do not know the exact cause, but there are various possible triggers, one of them being viruses such as the Epstein-Barr virus, cytomegalo, mumps virus, measles virus, and the enteroviruses. The second, it generally occurs in genetically predisposed patients. For example, those who have genes such as HLA-DR3 and DR4 are more likely to get it. There are also some preservatives such as nitrates which have been implicated. And type 1 diabetes patients usually are seen to have antibodies to various elements. For example, the GAD antibody, the islet cell antibody, and the insulin autoantibody. So these are the various linked factors to type 1 diabetes. As far as type 2 diabetes is concerned, this affects most of the people in our country, and this is related to faulty lifestyle. That is eating fried, fatty, refined, junk food and avoiding natural food, the traditional Indian home food. That is what seems to be the most important factor. Secondly, patients no longer exercise or have physical activity as before, and the levels of stress are much higher today than earlier. So these are the three important factors. Obesity is seen, and obesity is also linked to these factors. In type 2 diabetes, there is insulin resistance. That is, there is enough insulin, but the body's tissues do not respond to it. They are resistant to it. And obesity has underlying insulin resistance. The characteristic feature in Indians is that we have central obesity. We have visceral obesity. That is obesity in there is fat in the around the abdominal organs. And this is what differentiates us from others, and we mainly need to focus on cutting down this abdominal obesity. Another factor that we're seeing these days is vitamin D deficiency, and there are vitamin D receptors all over the body. So therefore a deficiency then also is seen to affect insulin secretion and insulin sensitivity. So that too can be a contributing factor.
What kind of preventive therapies are available today for high-risk diabetes?
For type 1 diabetes, a lot of research is going on. They have tried immunosuppressive therapy with drugs such as cyclosporin and azathioprine. Ongoing research involves taking oral insulin, which the patient needs to take once a day, and this would then stimulate tolerance in the patient and prevent the cells from attacking its own cells of the body from attacking its own body. So this is oral insulin. Secondly, drugs are being developed which will then modify the T lymphocyte, which is what causes the destruction of the beta cells of the pancreas. And thirdly, there are some studies which are going on involving DHA supplementation, which is omega-3 fat, and this is being given to infants less than 5 months of age and also in pregnant women to see whether it prevents or reduces the incidence of type 1 diabetes in the future. So that is for type 1 diabetes. For type 2 diabetes, there was a very important study known as the Diabetes Prevention Program, which was done in the US, and it showed that lifestyle intervention reduced the incidence of diabetes by 57%, and using a drug like metformin in those with prediabetes reduced it by 31%. So the most important thing in prevention is lifestyle change. That is cutting down on junk food, having more whole grains, cutting down on sugary drinks, having less processed foods, less processed meats, having more fruits and vegetables and having more fish, and cutting down the oil intake.